Sometimes patients can have complexities, narcolepsy, abnormal movements while they're sleeping.
I didn't stop breathing. But what I didn't know is I was not getting a good, restful, deep sleep night after night.
For every 2 hours we're awake, we should be getting an hour of sleep. If we're on our phone at night scrolling, we've got that light exposure, which could potentially decrease our melatonin production. And that melatonin is critical for initiating sleep.
Your brain tells the body not to breathe?
Sometimes we can see that in patients that have had injury.
Why is bad sleep? Can they negatively impact my health?
Oh yeah, you can die.
Mind your health.
You got to mind your health.
Mind your health.
Treat yourself. You got to mind your health.
David Burke and I are excited to be here today on Mind Your Health. Rachel Ross has joined us to talk about sleep. You are the clinical director of the sleep clinic from MUSC. Give us the whole name of that.
It's MUSC Sleep Center, Bluffton.
I love that.
Yes.
I actually got to go and see it. It's amazing. For people who've never seen a sleep center, it is worth it because honestly, I had a vision in my mind of do-do, 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 right? Do people say that? That's
What? You lost me.
okay. Well, just like sleep center. How am I going to sleep in a sleep center? Right. That's exactly what I had. Like there's a large table with a mattress.
You got those comics where people get all the wires and then just relax and go to sleep.
Exactly. So let me just say it in a more professional way. Oh, hell no. It was nothing like that. It was amazing. So talk to us a little bit about what a sleep center is.
So at the sleep center, we are the eyes and the ears while the doctor is not there. So we are collecting data for the doctor based on the note as far as what they're looking for. So they submit an order telling what they're looking for. We read their notes, and then we apply the wires, and then we educate the patient, of course, discussing the things that we'll be looking for. So sleep staging, breathing efforts, oxygen level, heart rate. Sometimes patients can have complexities, narcolepsy, abnormal movements while they're sleeping. We record all of that on software, and then we also have video recording too to be able to notate during the sleep study.
Let's talk about sleep in general and why someone would go to a sleep center. Do I use my primary care physician? Do I need a referral? I mean, I think a lot of us are really naive when it comes to anything about why it's even important to, why do we even worry about it? Why do we worry about sleep? Why would we even need a sleep study?
So, hey, it's funny you mention that because I see tons of people. Okay, sleep, it's usually the lack of sleep.
Got it.
Right? So I think she's doing a little different, but, I think worry is the key word there. I know a lot of people.
There's kind of like a stigma, like what does that look like? And if we were to say, go watch a video on YouTube, you see all the wires and it's like, whoa.
Yeah.
But then the whole basis of it is we're trying to be able to collect data for the provider to be able to help the person that whatever it is what they're dealing with. And then you also got an aspect of if the patient doesn't realize they're doing it. So if they sleep alone and they're, no one's saying, hey, you're pausing and you're sleeping or you're doing abnormal movements, sometimes that's not known to them. So if they have a bed partner or a roommate or somebody that experiences that, they can say, hey, you might need to get that checked out.
So, Rachel, what I hear you say, basically kind of taking it to the beginning is, I'm living my life. My partner says, honestly, Debbie, I think you've been snoring. I feel like you've been restless. You tell me you're not sleeping well. You're up in the middle of the night. I go to my doctor, right?
Mm-hmm.
And then they would say, why don't we get a sleep study?
Yes.
Or, it's kind of like talking about those, right? Doing a sleep-wake evaluation. Exactly. What does your sleeping situation look like?
You can tell it's a woman's point of view. She's like, oh, honey, you're not sleeping well. My wife said, if you don't do something, you're on the couch for the rest of your life. So it's all right. So I get it because I've been there, done that. So where I thought you were going to go is, and what with me is, I didn't have apnea. I don't. So we need to define.
Yeah, do all that. Yes.
I didn't stop breathing. But what I didn't know is I was not getting a good, restful, deep sleep night after night.
Okay.
So I was powering through it. I was going to bed, 10, 11 o'clock. I was getting up, 6 or 7 o'clock in the morning, working all day and just powering through it. Exhausted.
Okay.
And I didn't equate. I'm like, oh yeah, I'm snoring. I'm getting older.
Yeah.
I put on a 1 or 2 pounds. And, I didn't know how bad I was. And when she was like, you got to do something.
So let's define some of these terms. What's just different between bad sleep? What is apnea? What are things that can actually adversely affect my health when it comes to sleep?
I feel like some of the things that we could see bad sleep would be not getting enough sleep during your sleeping period. So they typically say for every 2 hours we're awake, we should be getting an hour of sleep. So on average, we should be getting between 6 and 8 hours. If we're on our phone at night scrolling, we've got that light exposure, which could potentially decrease our melatonin production. And that melatonin is critical for initiating sleep. We also have the airway closure portion of it, snoring, narrowing of the airway. You can have the central component where the brain tells the body not to breathe. That would be the sleep apnea portion of it.
The brain tells the body not to breathe?
Mm-hmm. Yeah, so sometimes people, if they have underlying heart conditions, if they've had any type of damage to the brain,
Okay.
that kind of thing, sometimes we can see that in patients that have had injury or congestive heart failure or things like that.
Can I ask a dumb question? So what? So what? Why is bad sleep?
Why is breathing important? Yeah,
Why is breathing important?
So what? Is that where you're going to go?
Well, yeah. Well, I was going to say, I think so many people have these things
Yeah.
and they don't do any, like you even said, you just thought you were pooped, you were tired.
Yeah.
But can they negatively impact my health?
Oh yeah, you can die. I mean, not literally, but
Well, yeah.
I'm sure you'll corroborate. But the stress of heart issues because of this lack of sleep, lack of deep sleep,
Okay.
sets you up for failure in all sorts of cardiac events. So it's right. So like I said, and there are documented cases of real famous people that had sleep apnea that had heart attacks in young people, 50 years old.
Is there a demographic?
No.
Okay, so
No, there are young kids, there are babies, premature babies that are born that could have sticky lungs and they need CPAP to help them breathe. We have children that can have naturally like small airway that's given by the family, so familial small airways. I mean, personally, my husband has a naturally small airway, so he has passed that on to a few of our kids. So, it's definitely... I feel like it knows no bounds, but then also too, I feel like the education piece of that when speaking to someone about sleep apnea and they find out that this could be something that a child could have or something that someone that is in their 20s could have. They're like, wow, I had no clue. I mean, sleep apnea has been out since the 50s, and I feel like with the wearable tech that we have,
yes, yeah.
watches and all that, you have that ability to keep track of how you're sleeping. And I feel like technology is getting better. And that's also, people are empowering themselves to say, hey, I noticed that, I didn't sleep as well as I should. And this ring told me that my HRV, my resting HRV wasn't good. So I need to, work on that. And I've tried exercising. And
So here's what go for it.
No, go ahead.
Well, I was just going to say she started using a lot of terms, collecting data, HRV. When you're collecting data, what is the data that you are collecting? What are you looking for? Are you looking for my quality of sleep? What are you looking for?
Yeah, so quality of sleep, and then it also, we're looking at stress too, your stress levels. A lot of this data is given, this was your stress during the day, and this, because of your stress during the day, when you slept, this is how much you recovered from that stress, which could lead into the next day, it's definitely interesting.
I think with me, it started with anatomy. So I had really bad allergies as a kid. So I have really bad overgrown sinuses, tissues.
Yeah.
So I'm a mouth breather to begin with because I'm so congested up here.
Okay.
Now I heard, one of the ways to fix that is they go root it out of there and
Okay.
it's supposed to be brilliant.
GP3.
So I'm like, I am not doing that. So what are my alternatives? Because like I said, I took the questionnaire, do you fall asleep during the day? I'm like, no. Do you do this? No. I'm like, I'm good. I don't have this. And then I did the sleep study.
Okay.
And then I got the machine. And ever since then, I didn't realize how bad I was. my biggest thing is, like I said, I would get up, I'm not a coffee drinker, but I'd get up in the morning, hit the shower, and then I would have hot tea for caffeine.
Okay.
So I was good, and I would just, power through it, not realizing that I just was waking up tired.
So is that part of what this? Let's go through what a sleep study would look like. So I've been referred to you. Take me from that step. I'm clueless. I'm a little nervous. I've never had no idea. I've been referred by my primary care doctor after my lovely husband graciously.
Don't look at me.
No, I know. Not him. Yeah, not him.
So
My.
we schedule the patient to come in to see one of our providers. And at that time, they do a sleep-wake evaluation. So
Okay, what does that mean?
a sleep-wake evaluation is where they talk about the symptoms. Has anybody told you that you pause in your breathing? Do you wake up and feel like you have pauses in your breathing?
Okay.
Do you feel awake during the day? So we fill out this, it's called a ESS scale, excessive sleepy scale. And that kind of grades you in certain situations. How likely are you to fall asleep at the wheel? How likely are you to fall asleep? If given the opportunity to take a nap after lunch, things like that. Sleepy scale is usually filled out in the office.
Okay.
Then we discuss those symptoms.
Okay. Okay, Debbie, you follow.
Yeah. What's your sleep and wake schedule? What time do you wake up? What
Okay.
time do you go to bed? Do you have any animals that sleep in the bed?
Okay.
Anything that would
Like, do you get up and go tinkle in the middle of the night as you get up?
during the night? Things like that. Is there any allergies? Do you have any stress right now? What is your occupation? Things like that to be considered.
So it's comprehensive.
Mm-hmm.
Next.
Absolutely. Once the provider meets with the patient, if appropriate, then they will order testing. Then the testing will be scheduled. The patient comes into the sleep laboratory, sleep center, and we will then greet
Young
them.
Frankenstein.
Yes. Sleep laboratory. We take them back to their room. We explain the process. We place wires.
Well, wait. Whoa. Okay.
Yeah.
I know. See.
What do you know?
Whoa. Let's describe some of the rooms.
Okay.
Because again.
Well, so like I said, I want to go gentle here because I had a medium kind of experience in the sleep lab.
Okay.
So
Not their sleep.
yeah, right. With it off. So I go in, and it was, they sat you up. Okay, go to bed. They put all the EEG leads on your head,
Okay.
and it's like you have to sit here because you can't move because you're all wired up. I don't sleep on my back. I'm a belly side sleeper. Well, you can't do that. And then, you heard Rachel say, the videotaper. Well, I'm like a dark room guy. I like it completely dark. Well, it can't be really dark because the lights are on. And then it was it's a commercial building, so there's 2 bedrooms with a bathroom in the middle. Well, in the middle, so I'm watching the basketball game. She says, "Okay, turn
We got
the
this.
TV off. It's time to go to bed." And I'm like, "I'm not running a basketball game." Nope. And I'm like, "Okay." And so turns the lights off, and then 3-4 o'clock in the morning, the guy in the other room, the old as Methuselah, gets up to go to the bathroom.
My age.
He turns the light on. Well, it's a commercial fan that starts, and that wakes me up. And then, like, at 5 o'clock in the morning, she goes, "Okay, sleep's over, go home." And I'm like, "It's 5 o'clock in the morning." So, and then she said, "Look, you're awake here." I'm like, "Yeah, that's the bathroom. That's the basketball game." So I didn't get a good feel of, hey, here's your report. You got issues. So I can't really comment on that. What I can say is my biggest thing is they say, "Oh yeah, you got it." Qualified for the machine, and it has made a huge difference in my life.
It really has.
Without it, if I'm like Saturday afternoon and nothing, I've been working all morning, or just something, I'm going to take a weekend kind of nap, I'll put the machine on in the middle of the day because I feel so much better with it on.
Well, thank you for that testimonial.
Yeah, Rachel's like,
Rachel.
No, it's okay.
can we edit this guy out?
No, actually, it's great because I think that's exactly what people think.
Yeah.
So fast forward to the MUSC Sleep Lab.
We have,
I almost
I
flipped
have
when
to say, we have sleep number beds that have a heating element on the bed. So if
No.
Oh, I like it. Cool.
we also have adjustable beds. So if we have patients that sleep positionally,
Oh, so that's good.
yeah, Yes, we have infrared lights now, so patients can sleep in complete total darkness.
Because my last one was like this.
Yeah. Yeah.
But this is important.
Yes. Yeah. We try to do, our whole goal is we're like, trying to not stay in a hospital. We don't want it to feel like
It
that.
looks like a hotel room
Yeah,
to me.
definitely.
It's got a drawers, it's got everything. I mean, I was just blown away because I had the laboratory
Yes.
feel. Your experience.
Clinical.
Yeah, clinical. And it was,
Mhm.
no, you've got beds. I mean, it was wonderful.
So tell me how they make it differentiate. So I mean, we kind of alluded to it, getting up in the middle of the night. I'm 63, I got
Yeah.
urinary issues like every other man known to man. And I also struggle with people in my practice of, I'm not getting 8 or 9 hours of sleep. They're 85 and they have done nothing all day. Does the body need 8 or 9 hours a day? I think we're missing, some of the part we're missing is the quality of the sleep,
Mhm.
not necessarily the quantity.
Yeah, quality is definitely important. And as we age, that becomes more important to us.
Correct.
So if we have things, things like pain can interfere with how much sleep we get because we need a position change. And if the sleep apnea component is controlled, if that's not something that's an issue, then that would definitely be, the activity during the day that we experience helps set us up for good sleep because we are tired, we had a full day, things like that. So sometimes patients can experience troubles with initiating sleep if there's not that component that has been met, in my experience.
So the first part of this is actually going through the study at the sleep lab. And then does the physician kind of follow us through? Are you there to educate me? I would imagine there's a learning curve to this.
Oh, yeah.
So it's not as though you just throw my sleep app at me and then say, thanks, have a nice day.
Yeah. So typically what we'll do is we are the data collectors, the note takers. The doctor will, once we are done scoring, we call it scoring the study.
Okay.
We finalize, generate a report. Then the doctor will pull up the study, review it, and then make notes. And then the patient comes back into clinic to talk about the results. What was observed and how can we help you sleep better? And that's where they talk options on treatment if need be.
And one of the things that you all talked about when I was really inquiring about this whole thing was the patient can keep coming back and chatting with you about how to work with the CPAP machines. Maybe I'm not attaching it correctly. Maybe I'm not doing some things correctly, and you can help us.
Absolutely. So definitely once the patient is set up with CPAP, that's kind of a handshake that our office does with their office. If for some reason they can't help the patient, we tell patients, if you need anything from us, please let us know. I have no problems, meeting with the patient to discuss issues.
So talk to me about CPAP machines. You have one, your husband has it. We talked about there. Again, those have connotations of being very difficult to manage, use, uncomfortable and inconvenient. How do you dispel that myth, both of you?
Well, just real quickly, if the industry has made personal preferences a huge priority, because I use a little teeny pillow,
Okay.
rubber pillow that goes under the nose.
Okay.
Some people like, oh, I can't do that. Some people have the mask. I wouldn't be comfortable with the mask. So there are a myriad of appliances. The machine's a machine.
Right.
Oh, when I first got one, somebody says, what's it like? And I said, well, the hose that's on your vacuum cleaner, if you put it in the other way, the air just blows out. I said, it's kind of like that.
That's exactly what I was going to ask you. What does a CPAP machine doing to me? What is it?
It's compressed air. It's forcing air to keep the airway open.
Yep. Splints the airway to keep the airway from collapsing.
So what does it feel like to me?
So that's my point. So, take your blower, your driveway blower, stick it in your face. You would think it's like that, but it's not even anything like that. It's amazing how just by putting it in your nose, you don't feel that there's, a blower going in your nose. You're breathing normally and perfectly comfortable.
It makes me wonder if everybody ought to have one. I would think getting all that good oxygen to your brain's a good thing.
So for me personally, I feel that 1 in 4 men have sleep apnea. As women get older, our cases get just as high. So, there are people in this world that maybe don't fit the profile that do have sleep apnea that should be considered for testing, but might not feel that way. But it comes to wearing CPAP, CPAP is an absolutely amazing thing.
Okay.
And I feel if I would ever not need it, I would still want it, just because there are people that could have airway closure but don't have a high enough index. So when we look at apnea, we look at an index. How much apnea do you have?
And maybe this is a slight shift, but medically, because again, pharmacist, and I know you have the physician, are there medicines? I mean, is it possible that the sleep study will show that I have narcolepsy? Is that treated with CPAP, or are there medical interventions? I mean, I'm imagining it's just not one size fits all, because you're
Correct.
treated. What are you looking for? Insomnia?
Yeah. So a lot of times patients will present with insomnia symptoms,
Okay.
which could be related to I can't initiate to stay asleep because
Okay.
I'm having airway closure.
Okay.
Or just not good established wake and sleep times.
Okay.
So that's what we use the sleep study for,
Or-
to iron that out.
Okay. Or anxiety, which would be
Yeah,
cognitive behavioral therapy.
Mhm.
Okay.
Yeah.
And then bringing us back, are there medical interventions for sleep issues?
So like I said, the biggest thing that I see is the insomnia.
Okay.
So there's obviously medicines to help you fall asleep, stay asleep,
Right.
but that's a whole big can of worms
Okay.
that I don't know, may or may not show up in a sleep study.
And so really what you're trying to do is decide if do we need is that considered a medical intervention?
So yes, and it would be, if given the opportunity to sleep, how long does it take you to fall asleep?
Okay.
And once you do fall asleep, what do we experience that we can share with the provider to help you feel and sleep better?
And so really what you're looking at are there are stages of sleep.
Yes.
And are you looking to see if those stages are acting appropriately?
Yeah, there is a rhythm that we sleep in.
Yeah, that okay.
And that's what we're looking for. So, and when we have patients to put wires on and we're like, here, sleep in a bed that you don't normally sleep in, it definitely skews the data a little bit.
Okay.
But we're looking, when you hit stage 1, what does that look like? How is your snoring? How is your breathing? What's your heart rate look like? All those things.
Okay.
What do your leg kicks look like? Are you moving your legs at all? When you go into stage 2, same thing. What does that look like? So we want to see a piece of each stage of sleep, a portion of it, to see what that sleep looks like during those stages,
Mm-hmm.
to be able to say, okay, in this given period of opportunity, this is what we saw throughout the stages. And then total sleep, this is what we saw. And then that's when the provider would speak with the patient about those.
And in another
findings.
podcast, we will talk about stages of sleep. But I think just for the sake of this podcast, there are 4 stages of sleep. And that is what you really pay attention to.
Absolutely.
I mean, it's an interesting subject. I think sleep is so important throughout the years, as you're showing it. Thank you so much. We'll have some pictures, I think, too, of the sleep lab that I think will be really, really helpful.
And the last thing I want to talk about too is the either the not misdiagnosis but the undiagnosis. That so many people out there are oh well I'm just older, I snore, deal with it. They don't realize the importance of their total health in getting that addressed.
So,
Those bad things happen if you're not getting into those stages of sleep, if you're not well rested, if you're not, the stress that you're putting, we talked earlier about the, unforeseen and unhidden diagnoses.
yeah, exactly.
Sleep is huge out there
Yeah.
Well, Rachel,
that people ignore.
exactly. Rachel Ross, thank you.
Thank you for
Yeah,
having
but
us.
it's so interesting, and everything really ties together. And that's why we named the podcast Mind Your Health.
Mind your health.
Got to mind your health.
Mind your health.
Treat yourself.